Welcome to the Deep Dive. Today we're stepping into the fast-paced world of the ICU. And you know how much I love exploring cutting-edge medical tech to see how AI could predict acute kidney injury, or AKI. You sent in some seriously cool research on this, and thankfully, expert speaker is here to help us make sense of it all.
Yeah, thanks for having me. It's definitely a hot topic, huge potential to really change the game in critical care.
I'm ready to hear all about it.
Yeah.
So before we get into the AI part, could you give us a quick rundown of why predicting AKI is such a big deal, especially in the ICU?
Absolutely. So think of your kidneys like a super efficient filtering system, constantly cleaning your blood, right?
Right.
AKI is when that system suddenly malfunctions. And in ICU, where patients are already in a critical state, even a small hit to kidney function can spiral into something much more serious.
Okay, that makes sense. Everything's connected. So how does this new AI model change how we tackle this problem? It seems like we've been trying to predict AKI for a while now.
You're right. And this research is particularly exciting because it introduces this idea of a self-correcting AI.
Yeah.
Imagine an AI that doesn't just analyze data, but actually learns from its own mistakes in real time. It's a huge step forward from the traditional AI models we've been using.
Wait, hold on. The AI is correcting itself as it goes. That's wild. Can you walk us through exactly how that works?
Of course. Picture this. The AI is constantly analyzing incoming patient data, vital signs, lab results, you name it, and making predictions about the patient's risk of AKI.
Okay.
Now, here's where it gets really interesting. Every time new information comes in, the AI compares it to its previous predictions. If it was off, it doesn't just shrug it off, it actually uses that error to adjust its understanding of the patient's condition.
So it's like it's constantly refining its own diagnosis, getting smarter with each piece of new data.
Exactly. And that's a game changer for a few reasons. You see, the ICU is incredibly dynamic. A patient's condition can shift dramatically in a matter of hours. Traditional AI models often struggle to keep up with that level of change because they're trained on static datasets. This new self-correcting approach is different. It thrives in that dynamic environment, making it much more effective for real-time clinical decision-making.
It's like it has its own little internal feedback loop, always learning and adapting. Now, I'm sure our listeners are wondering, did this actually pan out in real-world testing, or is this still just theoretical?
Great question. They put this AI to the test using two massive ICU datasets, MIMAC-3 and the Philips eICU Collaborative Research Dataset. These are both gold mines of real patient information, giving us a solid idea of how this technology would perform in a real clinical setting. And the results, let's just say that they're pretty impressive. Impressive is an understatement. This self-correcting AI really blew traditional AI models out of the water when it came to accurately predicting AKI.
Okay, now you've got to give me the numbers. How much better are we talking?
So one of the key metrics we use to assess these kinds of AI models is something called AUC, which stands for Area Under the ROC Curve. Essentially, it tells us how good the AI is at differentiating between patients who will develop AKI and those who won't.
So a higher AUC basically means the AI is less likely to miss those critical cases.
You got it. And in these studies, the self-correcting AI scored incredibly high. On the MINC3 dataset, it achieved an AUC of 0.893. To put that in perspective, an AUC of 0.5 is essentially random guessing, and anything above 0.8 is considered to be excellent performance.
Wow, 0.893 is amazing. And what about the Philips eICU dataset? Were the results similar?
Very similar. It achieved an AUC of 0.871, still significantly better than any traditional model. But here's what's even cooler. This AI goes beyond just predicting AKI.
Oh, now you've really piqued my interest. Tell me more.
The researchers incorporated a clever little technique called a regularization method. Now, without getting too deep into the technical weeds, imagine it like this. The AI is not just looking at current data, but it's also learning to anticipate future values of important patient metrics.
So it's almost like the AI is developing a sixth sense, anticipating how a patient's condition might evolve.
Precisely. Instead of just reacting to the here and now, it's using data to develop an understanding of potential future scenarios.
Yeah.
And by incorporating those anticipated future values, the accuracy of its AKI predictions gets another significant boost.
That's remarkable. But with anything this complex, I imagine there had to be some challenges along the way. Did the research mention any hurdles they had to overcome?
You're absolutely right. One of the biggest challenges they faced was figuring out how to keep small errors from snowballing into bigger ones. You see, because this AI is constantly learning and adjusting based on its own predictions, there's a risk that an early mistake could cascade through the system, throwing off all subsequent predictions.
It's like that butterfly effect idea, that one tiny change can have massive unforeseen consequences. How did they address that?
They use something called the stop gradient technique. Think of it like this. Imagine the AI is a student diligently studying a textbook. If there's an error in the early chapters, it might completely misinterpret everything that comes after. This technique is like an editor stepping in, catching that early mistake and ensuring it doesn't distort the student's understanding of the later chapters.
So it's like a built-in safety net, making sure the AI stays on the right track. This is all fascinating, but I'm curious, how would this actually work in a real-world ICU-less setting? Would doctors be interacting with the AI directly?
Right, because we don't want to go too far down the replacing doctors route, at least not yet.
Exactly. This is all about empowering doctors, not replacing them. It's giving them the best possible information at their fingertips.
So they can make those life or death decisions even faster and more effectively.
It's like we're on the verge of a whole new era in critical care, and this isn't just some, futuristic fantasy. This feels tangible, real.
Oh, absolutely. And think about the ripple effects. If this type of AI can be used to predict and manage AKI, what other possibilities does it open up? Sepsis, respiratory failure. The potential applications in the ICU alone are staggering.
It really does feel like this is just the tip of the iceberg, and we're opening a door to a future where AI helps us tackle some of the biggest, most complex challenges in medicine. This has been an incredible deep dive, wouldn't you say?
Absolutely fascinating. I'm so eager to see where this research leads us.
Me too.
Yeah.
So for our listeners who are already geeking out about this as much as we are, what would you say are the next big steps for this research? Where do they go from here?
Well, I imagine they'll continue to refine the model, really put it through its paces.
Mm-hmm.
Test it on even larger and more diverse groups of patients to make sure it holds up. And of course, exploring those other applications we talked about, taking this beyond AKI and seeing what other doors it can open in critical care and beyond.
It's like we've only just scratched the surface of what's possible. Well, expert speaker, I always learn so much from these conversations. Thank you for taking us on this deep dive today.
My pleasure, as always.
And to all of you listening, thank you for sending in this mind-blowing research. Keep those questions coming, and we'll catch you on the next deep dive.